Hi guys, my name is Nicole, licensed clinician, and we're here talking about everyday things that impact our mental health and fitness. I got a comment asking to address some caregiver issues, and although that might not impact everybody right now at this point in their lives, there is always a possibility that you can go from just living your life to all of a sudden becoming a caretaker for somebody, whether that's due to an accident or some sort of a medical event. Um, we're finding out really that like things can kind of happen at any time, and it can be really impactful. So I don't know if I'm going to do a series on this or not yet, but I think just some things to really keep in mind is that first, the person who is enduring the illness or the accident um, is dealing with a lot of this like loss of independence and this feeling of, even if it's not expressed, this feeling of like, well, who am I now if before I was able to do all of these things and contribute in this way, and now all of a sudden I'm not able to do that. And that doesn't matter if it's a spouse, if it's a sibling, if it's a parent, a child, what have you. um and so we're understanding of that they're going through their own things, um, but also not allowing them to use it as an excuse, right? So they still need to treat you well. And if their frustrations and feeling of like just being lost gets a hold of them, it's kind of up to you to hold that boundary, to express it and hold that boundary of like, hey, you know what? I will help you and I can come back and help you, but right now I have to remove myself from the situation because you're speaking to me in a way that's hurtful, and I'm not going to accept that and reinforce that by staying here. So I'm going to remove myself for a few minutes, and then I'm going to come back, and maybe we can start over with a little bit less frustration, or a little bit less um negative interactions, so whatever you want to phrase it. um Second thing is to, you can't pour from an empty cup. um, that saying is probably beaten to death, but it's probably one of the truest things ever and one of the hardest things to learn and to put into action. That my dog is barking in the background. Um, we need to take care of ourselves first and foremost. And as people who are put in the caregiver position or who are naturally predisposed to caregiving, it's really difficult to do that because we feel like, okay, we have to take care of this other person first, and then we can take care of ourselves, when we are just being held together with, some gift wrap tape and WD-40, and that's how we're getting through our lives. Um, we don't do anybody any favors if we're on the verge of falling apart ourselves. And so, although it does seem like the person that we're taking care of might have a little bit more of a sense of urgency to take care of them, there's also a need to express for yourself what your needs are to them. Hey, you know what? I know when you wake up in the morning, you really like to, you know, get washed up and get dressed and then have breakfast. I need to take a shower in the morning first and then get myself ready. I can come and get you ready, and then we can have breakfast together. Um, Setting some sort of a limit like that and making that part of the routine, part of the expected routine, is that like, hey, you know what? Like, you're going to take care of yourself first, and then you can take care of your loved one. Or, hey, you know what? Fine, by all means, when we get up, I can get you ready, get you dressed, get you set up with breakfast. Um, and then, like, while you're eating breakfast, I'm going to go take a shower, and then I'll come and have my own breakfast. Or maybe I'll have my breakfast first before, whatever works for you. Um, but making sure that you make that time for yourself. And if you look a couple of videos ago, I was talking about these like small moments of self care, and I think those are really, really, really important. Sometimes it is very difficult to get away from the house, to get away from the person that you're caregiving for a multitude of reasons. And so having those moments and looking for those moments that you're able to engage in some self care, something that just gives you a moment of like peace and feeling connected to yourself as well as maybe to the other person, right? Two separate things. Um, and also able to give you just like a reset moment, right? So that might be like hiding in the bathroom for 10, not hiding, but like, going into the bathroom for 10 minutes and doing some sort of a hygiene care thing that's not basic hygiene, right? So like it's not like, oh, let me go take a shower for these 10 minutes and hurry up, right? It's maybe I'm going to go into the bathroom for 10 minutes and do a face mask or a skincare routine that, maybe isn't part of my normal everyday routine. Um, and that's not just limited to females, right? Like guys can do that too. Guys can also be caretakers. Um, so I really encourage you to pay attention to those moments, um, and to hold firm with boundaries. And let me know what some of your moments could be, some of those little glimmers that kind of give you a little bit of renewal during your day.